This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Welcome back to AM Northwest. This year, nearly 44,000 women will die from breast cancer. At the same time, there are nearly 4 million breast cancer survivors in the country, and that's because of new treatments and research. Here to share more, we welcome Providence Cancer Institute oncologist and researcher, Dr. Sasha Stanton. Good morning, doctor. How are you?
Good morning. How are you?
Good. First, remind me, though, of breast cancer symptoms and also of screenings.
So, with breast cancer can be asymptomatic, which is why we ask for screenings. But if you notice, and I've had many patients who've noticed that they have a lump in their breast, it doesn't have to be painful, or changes in your breast, such as drainage in your nipple or skin changes, to talk to your primary doctor and have them check it out. They will send you for a mammogram and often an ultrasound and further testing. And really that's the knowing your own body and being able to recognize if something's not quite right is essential in detecting breast cancer early.
When it comes to breast cancer treatments, what's new out there right now?
Well, so one of the big things in cancer treatments overall is immunotherapy.
Right.
And that is basically getting your own immune system to be able to recognize your cancer and fight it. And some other cancers, such as melanoma and lung cancer, have had a lot more success than breast cancer, but we are slowly catching up. And that's really what's new and different out there in breast oncology.
And that's your specialty is research. Yeah. I mean, you're the research person. And by the way, stay looking this way because you've been looking off to the left. So stay right where you are.
Right where I am?
Right
all right.
where we are.
I'm so sorry.
That's okay. That's all right.
I do research. I don't do TV.
I totally get it. But you have some trials underway at Providence. So tell me about those.
So I work on vaccines, and I am both a breast oncologist and I work in the lab. So right. I am trying to develop new studies, particularly in breast cancer prevention and being able to have vaccines that will prevent breast cancer.
That's incredible.
But we really have a wide array of immune studies where, again, we're really trying to understand breast cancer and how breast cancer responds to the immune system. So in patients who have metastatic disease, particularly triple negative metastatic disease, the Earl Childs and Bernie Fox have designed a vaccine that we're giving along with immune checkpoint therapy. And this is being run by Dr. David Page at the Earl Childs and the Providence Cancer Institute for women with triple negative breast cancer early in their metastatic treatment. As we move more into therapy for people with local disease and working toward eventually eliminating the cancer, we have a trial that's actually open now in triple negative where we're giving a series of chemicals that enhance the immune system, plus again, established immune checkpoint inhibitors, which also enhance the immune system in triple negative breast cancer. And we will be collaborating and opening a vaccine trial for our estrogen positive breast cancers, which are actually the vast majority of breast cancers. Yeah. And we really struggle with those because the immune system doesn't see them very well. It doesn't interact with them the same way it does with, say, triple negative. And so we're trying to figure out how to add an immune therapy plus radiation or a very low dose chemotherapy that the goal is really just to enhance the immune system, along with letrozole, which is a very common anti-endocrine therapy. And we're trying to give that to our estrogen positive patients prior to surgery and see if we can get a better immune recognition of the tumor at the time of surgery. So we're hoping that'll be open in early summer.
And then who can apply for those kind of trials? Because getting involved in clinical trials is really a pretty good idea, right? Because someone's really paying attention to you.
Absolutely, absolutely, and with all clinical trials, if you contact the Providence Cancer Research Center, and there's a breast oncology portion of that, we have fantastic research coordinators and nurses that can see if you fit a trial. Talk to your doctor as well, because there are fantastic trials going all around the country, really where we have wonderful people trying to figure out this disease.
It does seem like, as someone who's been through breast cancer myself, and now it's been like 20 years, but every 5 years it feels like there's new treatments, and everyone who gets breast cancer has a different kind of a treatment program, it seems.
Absolutely. We really have been moving closer and closer and closer to personalizing breast cancer therapy, and realizing that it's not all one disease. So my grandmother also had breast cancer, and when she had it, it was you cut off the breasts and
right.
You gave everybody chemo. And now we really have personalized into, we have really 3 big buckets: estrogen positive, HER2 positive, and triple negative, and
right.
they all have different treatments. And we keep subdividing those buckets. So
yeah, it's
really
fascinating.
So much better.
And it's so much in part to do with how much research you're doing. It's incredible.
Absolutely.
We would love to tell our viewers you can learn more about research at Providence Cancer Institute by signing up for Creating Hope, the annual event that takes place May the 19th. It's free and online, so anyone can attend. It includes a behind-the-scenes tour of the immunotherapy labs at Providence, which is fascinating, by the way. You'll also hear from researchers about their work and inspiring stories from cancer survivors. Dr. Stanton, thank you so much, and thank you for all you do.
Thank you very much for listening, and any questions, really do reach out. I'm happy to answer people's questions.
Thank you. We'll be right back with more AM Northwest. Don't go away.